I think it's quite common for people to face mental health challenges throughout their life, a lot more than they will admit. A lot of young adults around my age experience more depressive episodes than they're willing to talk about. It was relieving to finally open up about everything I'd struggled with.
Christian Health was founded to address the unmet needs of those in our community struggling with mental health challenges. For more than a century, our organization has grown and expanded to meet the changing needs of the community. Today, we offer a full continuum of care for older adults, from independent senior living to assisted living, memory care, skilled nursing, and more recently home care, to best support those who wish to age in place. We offer inpatient and outpatient physical, occupational, and speech therapy, as well as a range of wellness classes and activities to help nurture and strengthen our residents and patients.
The pandemic magnified the need for quality and accessible mental health care in many ways. With the onset of the pandemic, most doctors' offices, including psychiatry offices, closed. There was a real fear about going outside your own home and being able to keep appointments. Telepsychiatry and telemedicine changed that, and it became very apparent that people were in need of mental health services and access to the same. Now is the time to expand mental health access and services because we really are being highlighted and we have the attention of all kinds of medical communities and folks out there where before we did not. Now is the time to really take the opportunity that's been afforded to us as a result of the pandemic.
I was working my first job in New York City and I was experiencing severe burnout and anxiety. I'd had a really stressful week, a few things happened, and by the end of the week I was scheduled to go to visit a friend. I missed both of my trains and I started to have a panic attack. In the moment, I had no idea what to do. I felt like there was no way out. I couldn't keep my eyes open, my mouth was glued shut, my hands were tingling. It was the worst panic attack I'd ever experienced. I had no other choice but to seek help. I had to accept it, and I couldn't run away anymore. So I rushed to the emergency room, and that's when I decided that an inpatient program was the best thing for me. I reached a breakthrough about halfway through my program. I realized that I had to let go of control and realize that sometimes it's just the way the cards are dealt, and it's about how we react to it that counts. Once I was able to finally pause and separate myself from all of these stressors in my life, I had the chance to structure my day however I wanted to. And at the time, that included walking, listening to music, journaling, drawing, painting. I was finally able to revisit my childhood and do all the things I love to do again. I had such a positive experience with all the clients and staff at Christian Health. I was truly blown away. I did not expect to receive the amount of overwhelming support that I did. From all the nurses who woke me up every day to take my blood pressure, to the clients I sat and had many conversations with. I actually still keep in touch with some of the people I met upstairs and downstairs in my partial program. It's really great to receive such an overwhelming amount of support.
We hope to expand our services here at Christian Health really to meet the community needs. And one of the results of the pandemic that became readily apparent was that the pediatric and adolescent population needed more help than we were able to give them across the state, as well as substance use disorder, domestic violence, and child abuse. All of those rose significantly, and so we are hoping to expand in all of those areas. People shouldn't feel ashamed or embarrassed to access the services that they need, whether it's to call for a psychiatrist appointment or a therapist appointment, or coming in for inpatient hospitalization. Just show up and we're here for you.
Our commitment to supporting the mental health of those in our community has never wavered. We offer outpatient counseling for individuals of all ages, partial hospitalization, and intensive outpatient programming, as well as an inpatient behavioral health hospital. Always looking to the future, our Board of Trustees and leadership team are committed to continued growth. Newbridge Services is joining the Christian Health family, which allows us to leverage shared resources to offer more services in a broader geographic area. We're working diligently to expand access to mental health services so that everyone who needs mental health care can access it. Support for our Good Samaritan Fund enables us to never turn anyone away because of an inability to pay.
Mental health education is so important, especially right now. I struggled with my mental health in college, but I wasn't prepared for what lied ahead. It is so important to teach each other empathy, starting in the home, in school, and even the workplace. It's important to realize that we don't know what someone else is going through when they walk through the door. The first step in reducing the stigma around mental health is talking about it, because chances are someone else is struggling too.